Welcome, everyone. I'm Ron Brookmeyer, Dean of the UCLA Fielding School of Public Health. Thanks very much for joining us tonight as we continue our Fielding Focus webinar series with an important discussion about the impact that COVID-19 is having on healthy living and wellness. Our routines have shifted dramatically in recent months. COVID-19 has forced us to examine how we practice and balance social connection during this time of physical distancing. And although we know that taking care of ourselves and the ones we love has become even more important, this pandemic has brought unprecedented challenges and stressors. Our moderator today, Mike Prelip, is an exceptional professor and chair of the Department of Community Health Sciences at the Fielding School, and is the ideal person to lead us in this discussion. Through his research and collaborative field projects with communities, he has had tremendous impact in areas such as community nutrition and wellness, health communication, and health promotion interventions. I'm so grateful to Mike for convening our panelists, and without any further ado, it's my pleasure to pass it off to him so that we can dive into addressing COVID-19 and wellness and healthy living. Mike?
Thank you so much, Dean Brookmeyer. I want to welcome everyone. And first of all, it's just, I think this is the most number of people I've invited into my home before. I think by the time everyone's done logging on, we'll probably be 250 to 300 people joining us tonight. And I'm just really glad to have you all here. I know that as we think about our lives right now and how COVID-19 has impacted all of us in so many different ways. And when it comes to just thinking about our health and our wellness, it's impacted us on so many different levels. I mean, certainly we think about ourselves, probably should be thinking about ourselves a little bit more, but just thinking about our communities and our families and our coworkers and the organizations we're part of, and thinking about all those great health behaviors we've adopted and how challenging it is today living during these times. And so I'm just really, really thankful for the panel that we've brought together today. I'll introduce them in a minute, but first a couple of housekeeping points. One, we are recording the webinar and it's going to be available later this week on the school's website, ph.ucla.edu. Also, we're really looking forward to the question and answer period at the end. And if you notice at the bottom of your screen, there's a Q&A button, and you can click on that and type in your questions, and we're going to answer as many as we can. And third, if you would like to tweet during the event, please use hashtag UCLAFSPH and hashtag UCLA Fielding Focus. So, so let's get going. I'm really excited to introduce our first speaker, Professor Dawn Upchurch. Professor Dawn Upchurch is a professor of community health sciences and the vice chair of the department. And Dawn, in her research, examines factors that are associated with good health. She assesses strategies for stress reduction and positive coping, and has long studied the potential for complementary and alternative medicine as health promoting tools. Dawn's a leader in her field, and she's widely recognized for her deep understanding of women's health and well-being across the life course. Dawn is also a licensed acupuncturist. So please welcome Dr. Upchurch.
Great. Thank you so much, Mike, and thank you all for being here, and thank Dean Brookmeyer and all the people who helped to organize this. So tonight I'm going to present some key topics and highlights on the growing impact of the COVID-19 pandemic on well-being and health of Americans. I'll take a population and public health approach in discussing these issues. That is, I'll be talking about the growing social, economic, and health impacts on American society and culture. Because there is so much misinformation on the news, social media, and the internet, I want to be transparent about my data sources. I use data from two reputable and scientifically respected sources, the Pew Research Center and the Kaiser Family Foundation COVID-related polls. They are the most recent data available. I also use recent articles from the New York Times that I consider to be scientifically sound and thorough. Next slide, please. Let's first start by looking at what we mean by well-being. There is no consensus among researchers regarding definition. However, there is agreement that well-being includes multiple dimensions, including mental, financial, physical, social, and so on. It is useful for public health professionals because it integrates these multiple dimensions of one's life, resulting in a more holistic approach to disease prevention and health promotion. Wellness and well-being are often used interchangeably, and in fact, wellness commonly incorporates these dimensions of well-being. Wellness definitions often focus a bit more on optimal functioning, that is, flourishing and empowerment, and is sometimes thought of as a way of life. I'll be talking more about well-being in this talk tonight. Next slide, please. Americans increasingly say their lives have been disrupted by the COVID pandemic, from 40% in mid-March to over 84% in late April. By late April, over half of the public believes the worst is yet to come, which declined from 75% just a few weeks earlier. The pandemic has become personal, with close to 1 in 3 reporting they may have had or were diagnosed with coronavirus, and 1 in 10 know someone who has died. As we know, COVID has a much greater impact on lower income communities and communities of color, laying bare the persistent and pre-existing social inequalities. The severity of the economic impact of the pandemic continues to grow, with unemployment rates the highest since the Great Depression. The extent of financial insecurity is much greater among lower income households, young adults, people of color. The numbers of people seeking food from food banks is unprecedented, and there remains a large unmet need in food insecurity. Next slide, please. Americans are continuing to shelter in place, with over 84% leaving home only for essential services such as groceries, medicines, and healthcare. Additionally, 80% say sheltering in place efforts are worth it to protect the public. However, others cannot shelter in place because they are essential workers, which is about 1/3 of adults. Essential workers also express higher levels of concern about becoming infected, and 4 in 10 say they live with someone with pre-existing health conditions. We're also seeing increases in social isolation, which has a direct impact on health. Almost half of those sheltering in place say they have worry or stress about COVID. Their worry or stress about COVID has had an impact on their mental health, compared with about 1/3 who are not sheltering. It also increases loneliness, which affects both mental health and physical health. It is particularly concerning for older adults and teens. And for some, home is not a safe place, and reports of domestic and child abuse are on the rise. Last, sheltering in place exacerbates the digital divide across households, with some not able to work from home because of no or inadequate internet connections, and with homeschooling, many children are affected. Next slide, please. We've all experienced stress. It's a normal part of life, and we need some stress in our life to grow. However, evidence is mounting on the impact of stress on both mind and body. The stress response affects all physiological systems. Research shows higher stress increases risk of diseases that are major causes of death in the US. One measure of physiological stress is an index called allostatic load, which assesses physiological dysregulation across multiple systems. So how do we measure stress? One way that is commonly done is to simply ask people who are part of surveys about their stress, called the perceived stress scale. In a longitudinal study we conducted with midlife women, we found that women with higher perceived stress actually had faster rates of increase in allostatic load over a 14-year period, thus hastening cellular aging. COVID-related stress only adds to the physical and mental health consequences of chronic stress. More than half of Americans report their mental health has been negatively affected. And while majorities across most demographic groups report COVID-related stress affecting their mental health, the percentages are higher in young adults, people of color, women, those with lower incomes, and those who are less healthy. Also, poor mental health due to burnout among hospital staff, first responders, and other frontline workers is growing. Next slide, please. As public health professionals, we're all aware of the importance of healthy lifestyle to maintain and improve health. But what we're seeing is that over half of adults report COVID-related worry and stress has had a negative impact on health and healthy behaviors, especially trouble with sleeping, eating more or less, eating differently than they normally do, mood control issues, and increases in alcohol and substance use. And it's anticipated that these unhealthy behaviors will continue to grow. Next slide, please. With such uncertainty, it is challenging to think about what this new normal might look like. Much of it will depend on the combined contributions of research, politics, public health policies and mandates, as well as the individual behaviors of the American public. Next slide, please. Thank you. Here are some resources and references. I didn't want to end just on a negative note. There are a few resources you can go to get information about stress and about how to manage stress and so on. Thank you very much.
Thank you so much, Dawn, for that great overview about what's happening with folks in dealing with COVID today. Our next speaker is Professor Ted Robles. Professor Robles is a professor of psychology at UCLA, and in his research, he examines how stress and social relationships influence health with a focus on allostatic biological processes, which help individuals achieve psychological stability during stressful events, and restorative biological processes, which aid in the individual in recovering after stressful events. Ted is also the leader of the campus's Engage Well pod, which is part of the Semel Healthy Campus Initiative at UCLA, which focuses on healthy social relationships on campus. Please welcome Ted.
Hi, everybody. So thank you, Michael, for the invitation. I'm going to be talking about social well-being during this period of social distancing and COVID-19. Go ahead, next slide. My comments are grounded in research that I and other people have done on the quality of our social connections and our physical health. And next, I discuss that in much more detail in a paper with several colleagues on advancing social connections as a public health priority. You can access that paper by using the QR code at the bottom right. And there are other papers as well, next, in Nature Human Behavior that are really excellent summaries of the contributions of social and behavioral science to understanding how we can combat COVID-19. So I invite you to take a look at those after you've watched this webinar. Next. So our social relationships are important for our health for several reasons. First, since the dawn of our species, we've found safety in numbers. Next. And but we don't have that as much anymore, as we'll see. The other thing is load sharing. So we often work together towards common goals where the effort of 2 or more people decreases the burden on any one person. So things like building shelters, making meals, or even training master's students. Those are all done in a much more efficient and less burdensome way if we do them together. Next. But of course, social distancing has totally upended those benefits. We no longer feel safety in numbers. We feel anxious and unsafe around people. And because we can't see each other in person or work side by side in many cases, it's very hard to lean on each other for support and to work together the way that we've evolved for. Next. So I'm going to be talking a little bit about loneliness today, and Dr. Upchurch mentioned this as well. Loneliness is defined as the distress that arises when there's a discrepancy between what you want in your social world and what you actually have. And before COVID, there were already concerns about an epidemic of loneliness. So this is an infographic from Cigna, where in their survey of 20,000 Americans, they reported that approximately 1 in 4 people reports rarely or never feeling as though there are people who understand them. And we know that loneliness is a risk factor for poor health and premature death. Next. And this article came out right at the beginning of the pandemic and on concerns about social distancing and what it's going to do to loneliness. And so my colleague, Julianne Holt-Lundstad, said that just as we're worried about an economic recession, we should worry about a social recession that might have broader societal effects, particularly for the vulnerable. So what I'm going to do next is just kind of give you a brief snapshot of what survey data is telling us about connection and loneliness at this point. Next slide. So I want you to ask yourself, in the past week, would you say you feel more connected, no change, or less connected to family and friends? So just think about how you would answer that question. Next, that question is from the Gallup panel, which is repeatedly administered to a representative sample of thousands of Americans on a regular basis. Next, and this is the data from March 23rd to April 13th, there on the x-axis. And on the y-axis is the percent of respondents endorsing either no change, less, feeling less connected, or feeling more connected. And while half of adults surveyed reported no change, and that stayed somewhat stable over the course of the first, say, month of the pandemic, at least since March 23rd, the proportion of individuals reporting feeling less connected to friends and family has been increasing and increased during the first 2 weeks of April as we've implemented social distancing. Next. Now, who is more vulnerable? They didn't parse this data in quite the way I would like. For instance, they didn't report anything about ethnicity, for example. But what we do see in the Gallup data is that women, young adults, and older adults showed larger increases in the proportions of people feeling disconnected over the first month of stay-at-home orders. Next. And you also see this in other COVID surveys. So in a very large survey in the United Kingdom, living alone, living with children, having lower income, and living with cities were all factors that were associated with higher reports of loneliness. And broadly speaking, the structural inequalities that are really making themselves known in so many ways, those also are contributing to risk for loneliness and poor social well-being during this time. Next. So for the rest of the time, I just want to briefly touch on how we might mitigate harm to social well-being. How can we bring safety in numbers back, even if we're distant? And how can we continue to sort of share the load that is life? Next. And one thing that's really great about speaking to this audience is that I really only know about individual sort of and group level processes, and all of you are much more adept in understanding and capable of making changes and thinking about policy and institution level and environmental changes. But I first want to touch on what psychological science has to say about how we can increase safety in numbers and sharing the load during social distancing. Next. So how can we do this? How can we, what can we do at the individual level? Next. What I want you to remember is reach out. So there's a couple of different ways you can kind of remember that, either the Star Wars way or the R&B way. And I want you to keep, and so there are several ways you can reach out. One is keeping other people in your mind as you are talking to them, or as you're reading stories about what people are doing to help, or as you're reading about what burdens people are facing in this time. Just having people mentally in your mind is something really important. In addition, of course, reaching out by giving support to others is very important as well. It's just as important as receiving support from others. And in addition, fun and enjoyment. So there are things we can do for fun and enjoyment at a distance that are also really important ways that we as individuals can reach out to others. And finally, and critically, working together and sharing the load by giving back through advocacy, donating time and money and help to those in need. That gives you a sense of purpose and a sense of meaning, and it helps other people as well. Next. Now, to me, really the biggest challenge as we move forward is how to create a new social normal. And so I'm going to illustrate that with a personal example. Next. So I have a daughter in 3rd grade, and this is a rough, we're going to talk about environmental factors. Next. So I have a daughter in 3rd grade, and this is a rough sketch of her school day schedule. Next. And if we include her after school period, then about half the time that she's in school, she's doing what we might call unstructured social activity with her friends. And it's about the same as the time she spends with on formal instruction. And I put unstructured in quotes on purpose because while it is unstructured, it takes place within the social and physical environment provided by the school. And those are things that she's missing right now, in addition to her friends. And quite frankly speaking, those are things that my wife and I are doing a very poor job at trying to recreate. I obviously can't bring her friends here to our house, and we can't go to them. And we're not the world's best schedulers of social activities online and that kind of thing, because we also have our own work to do as well. And I think that's the way it is for many of us, that the structure of our workday created opportunities for unstructured social activity, like chatting informally with someone that you bump into down the hall, or on the way to the bus, or on the way to the car. Those things are not things we have anymore. We've got to find ways to put those back into our lives, to recreate the environments or create new environments that allow us to sort of work together and socialize. Next. So because our social environments and physical environments won't be the same for some time, for those of you that work at institutional and organizational levels, the really key challenge for this new normal is how do we enable people to distance socialize? Should be the next thing there. So science-driven answers to this question are essential for staving off social recession and obviously for helping us cope with the ongoing public health and economic crises. So I don't have any answers to this question. I'm hoping many of you can come up with creative ones and then share those as we move forward. So I'll throw it back to Michael, and I appreciate your attention.
Thank you so much, Ted. Really enjoyed learning more about this, and I think listening to it, just all of it that we all are experiencing and seeing in others. So thank you very much. Our third speaker tonight is Dr. Wendelin Slusser. Dr. Slusser is an Associate Vice Provost for the Semel Healthy Campus Initiative at UCLA, which is dedicated to fostering a cultural of physical, emotional, and social well-being. Wendy is also a board-certified pediatrician and professor of pediatrics at the Geffen School of Medicine, and also a faculty member in my department, Community Health Sciences. I feel very fortunate to have Wendy join us as one of our panelists. Wendy?
Thank you so much, Mike, Dr. Prelip, and Dean Brookmeyer, and all the people that supported this webinar tonight. I'm greatly appreciative to all of you and everyone who's tuned in for this webinar. My talk is called Building a Culture of Health and Equity, One Campus at a Time. Next slide, please. A culture of health is the 5th wave in public health. It's building on the 4th wave, which was the social determinants of health. Next slide, please. How do we inspire a culture for health movement for individuals, communities, and the planet? Well, many of us have been on the couch, and many of us have been trying to nudge people off the couch. And I want a fitness video. Do you deliver? Next slide, please. Well, it was in 2013 that Jane and Terry Semel pitched the idea of the Healthy Campus Initiative. We were doing a really good job treating disease at UCLA, but not such a good job preventing disease. The goal was to make UCLA the healthiest campus to learn, live, play, and work for the over 85,000 students, staff, and faculty, and inspire others. We were infusing the culture of health on the campus at UCLA. Next slide, please. The facts are, in just 2 years after HCI's inception, we inspired President Napolitano to launch the Global Food Initiative, followed by the Healthy Campus Network, with great success on all 10 UC campuses. And to our great delight, Michelle Obama launched the Healthier Campus Initiative across the US and the Partnership for Healthier America in 2014, based on our proven UCLA model. And since then, UC Health and system-wide HR has supported the Healthy Beverage Initiative, the Diabetes Prevention Program, and the Stress-Free and Nutrition Research Program UC-wide. Next slide, please. The strategy is to build on the strengths of anchor institutions, and that's the university. It's really essentially asset mapping and mobilization. Next slide, please. Utilizing the ecological framework that you saw in Ted's talk, HCI provides the connective tissue between every level of the socio-ecological model: individual, social, physical, and policy environments. Next slide, please. Frieden's Health Impact Pyramid has helped HCI and HCN identify work that can be high impact at every level to build a culture of health that has prepared UCLA and UC-wide for the COVID-19 pandemic. Starting with the base of this pyramid, universities can directly impact the socioeconomic factors, not only through graduating students, but also as a large employer can impact economic well-being of staff and faculty. In fact, UC is the #1 employer in California outside of the federal and state government. Moving up the pyramid, we work on making the healthy choice the easy choice, all the way up to the counseling and education like the CDC Diabetes Prevention Program. Next slide, please. The Cdc Dpp Program, or Diabetes Prevention Program, launched by Semel HCI in 2016 and led by Dr. Tanaz Moin, School of Medicine, and Kelly Shedd and Samantha Soetanga in Recreation. They have now enrolled across the UCs, they're helping lead the effort across the UCs now. 845 people have gone through it, students, staff, and faculty. And we are now offering the classes since the pandemic virtually. As we all know, DPP reduces the risk of developing type 2 diabetes by 58% if you have prediabetes. So UC DPP has therefore prepared a large group of students, staff, and faculty to be better prepared during COVID-19, especially given that diabetes is one of the major risks for serious mortality and morbidity if someone has COVID or suffering from COVID. At UCLA, we can continue to offer this class, and we're very grateful for it. And one participant shared with us, right now, the information given to us is perfect, as I'm overloaded with too much input during COVID. Knowing that support is available via a quick email to my DPP leader is critical, and she's great. Right now, my only focus is stay healthy, safe, and sane in big capitals. This course is a pillar right now. And if you look to the right of this PowerPoint, you'll see a picture of a group of students who are in a kitchen. Now, this is pre-COVID, but in our research from some of our students in the School of Public Health, Tyler Watson and Hannah Milan, found that you could reduce people's food insecurity, not only by offering food access and availability to food, but also through food literacy. And that was what the birth of the Teaching Kitchen, we had a Teaching Kitchen program, and now we have a Teaching Kitchen. And luckily, we have been able to move to this Teaching Kitchen to a online experience. Thanks to Tony Sandoval and his talented team at UCLA Community Program offices, they have set up a virtual food closet, and we're offering 2 to 3 times a week Teaching Kitchen experiences virtually to grad students and undergrads. Next slide, please. Long-term preparation work through Semel HCI in collaboration with Renee Fortier, Director of Transportation, and one of our own Fielding School of Public Health faculty members, Dr. Dick Jackson. They set up the stage to fast track the bike lane from Santa Monica Hospital to Ronald Reagan Hospital during the COVID-19 recovery. And during the response to COVID-19, the Jane B. Semel HCI Community Garden is not only providing weekly harvests to our community, we're also supporting our students, staff, and faculty members with their efforts for their own victory gardens. Next slide, please. And this pandemic offers an opportunity for even more action by us public health professionals. As David Brooks says, we're standing at a portal to the future. How about if we reimagined this street in this picture that was emptied by COVID and reimagine it as if it was with bike lanes and parklets and other kinds of well-being promoting activities and structural changes. Next slide, please. Semel, HCI, and the Fielding School of Public Health and all of UCLA and UC have the opportunity now to identify unifying themes for recovery and resurgent phases of this pandemic. For instance, hold on to the good things you've learned during this pandemic. Keep momentum and strive for health equity. Prioritize health as much as wealth, as our colleague Professor Chai says in Singapore. Forge strategies for integrative health, social, physical, emotional, planetary, spiritual, and financial. And how about if we really took it seriously and implemented a national service for all youth? Next slide, please. Now, you never want a serious crisis to go to waste. So let's think about what kind of opportunities all universities can have to lead in collective impact. And let's blend the narrative for a culture of health with transdisciplinary teams. And let's asset map and mobilize our policies, our research, our academics, and our service, and our operations. Next slide, please. So, because with the realization of one's own potential and self-confidence in one's ability, one can build a better world. Thank you so much.
Thank you, Dr. Slusser, for telling us what's going on at UCLA and how people can be more engaged on campus. So let's go ahead and get into the questions and questions. So please keep sending the questions. Here's the first question. It's from Carolina Rodriguez, and I think I'm going to direct this to Ted. As a school nurse at a high school, my concern is how we gently enable students to socialize while maintaining distance and use of masks when we return to school.
So that, and I think the next question that I saw is very similar, which is sort of like, how do we establish the new rules of the road when we start to come back together? And, you know, one way to think about this is, let's just imagine that we could all get back to what we're doing tomorrow. Would you go hug a person that you've really wanted to hug for a while that you haven't seen? And I think some of us are like, yes, definitely. Like, even, forget about the risks in asymptomatic COVID. I'm going to hug that person because it's really important to me. And I'm sure some of you are thinking to yourself, I don't know, I might think differently about that. I might have second thoughts about that. So these are definitely legitimate concerns and something that we really do have to think about as these spaces start to open back up. And so the way I'll answer the question is that I think we, have to figure out what safe social contact is. And I think for those of you who are in positions to kind of ask the question, so I think the person asking the question is a school nurse, I think asking your administrators to have them ask public health advocate, public people in public health, like, what would safe social contact look like? That's going to be really important, because we all individually need to know very specifically what is possible. And if it's not communicated clearly, well, there's going to be a lot of confusion and a lot of frustration as, let's say a certain rule gets applied in an inequitable way. So one thing that it's going to be incumbent upon many of the folks in public health is to give us a sense of what will be allowable or, prudent physical social contact. Is it going to be nothing at all? Or will there be some things that are going to be okay as long as you wear a mask and wash your hands after? That needs to be answered. The second thing is, whatever safe social contact is going to be construed as, it has to be enabled. So using the school example, if we have to keep 6 foot distance at schools, then the environments are going to have to change in a way that makes that choice the easy choice, even if it's not one that we want to do. Like, make it easy for you or me to sit 6 feet away from somebody else. Make it easy for me to access hand sanitizer and hand washing stations, okay? So those kinds of environmental changes are going to be really critical. And then the third thing is, you're going to have to get people to want to do things like be 6 foot away from each other. Now, how we do that is hard, because I was talking to a reporter today, and I was saying all this social distancing stuff, it goes against every sort of fiber of what a human being wants in life. Like, we want to be with people, we want to be close, we want to hug, we want to touch, we want to shake hands. So we're going to have to fight that very powerful norm and drive, and we'll have to have new norms. And hopefully some of those new norms can be, sort of fun and entertaining, and we can kind of laugh at ourselves as we wear hats that have, big balloons on them that keep people 6 feet away. But the point being that we're going to have to find some ways to kind of message to people that this stinks, but it's really important. And we need to try to find ways to get people to want to stay distant. But I think the key thing will be very clear messaging and communication about what safe social behavior will constitute. And that's a critical question.
Great, thank you, Dr. Robles. With the other panelists, when someone answers a question, if you want to weigh in, please let me know. Okay. Dr. Slusser, a question for you. As a pediatrician and a public health expert, what have you learned during this pandemic?
Thank you for that question. For myself, there have been personal and then more professional observations. I'll start with the professional observation. I really have always strived to improve the health and well-being of those that might have less opportunities. And I feel that this pandemic has really unsurfaced and telegraphed to so many people the incredible health inequities of our country and our world. And I think we might have the ears for some of these people that might not have been aware of it at the time, and also they're experiencing similar threats, maybe not at the same level, but I feel that we have an opportunity to really work and strive towards improving the health and well-being and reducing these unequal opportunities that people have, especially the more vulnerable populations like children and older adults and people living in poverty. So that's my work view, and my personal one too. I'm working on it on a personal level. I think from a personal point of view, I like the slowing down piece of it, and I feel I'd like to see if that can be, I can retain, if I could retain that, more sleep. That's probably the biggest piece. And I as a pediatrician, I highly recommend that it's good for everybody, not just for the kids, but for the adults. So.
Thank you so much, Wendy. Ted, Dawn, do you want to give us any insights to what you've learned? Dawn?
Well, I think I agree with Wendy. There's this sort of personal professional dialectic, and I will admit that when this first all started happening, it was very stressful and anxiety producing for me as an individual. And then I also felt it was very important for me as a public health researcher and academic to see what we could do as a profession to help promote the wellness, well-being in communities, and also to really help provide good solid data for what's happening, because as I said early in my talk, there's a lot of misinformation about what's happening, and things are changing daily. And for example, the data I presented just a few minutes ago is from late April, and I'm sure things have changed since late April. We know they have, actually. So I think it's important to do some reflection and to also stay engaged in ways that are healthy.
Thank you, Dawn.
I was just gonna briefly say the opportunity to kind of remake things, maybe not next week, but in the years to come, because of the inequities that Wendy has pointed out, and Dawn as well, they have just come into stark view. that all these inequities that have been established for, decades, that, this might be an opportunity to really see that those things need to change. And I think there's a really great paragraph at the end of one of Ed Yong's articles in The Atlantic, which kind of lists everything. And those are the things that I think now everybody realizes needs to change.
Thank you, Ted. Here's a question for you from Gail Feldman. Several studies have shown the detrimental effects of excessive screen time for children. Yet in order to facilitate distance learning and distance socializing, our children are on screens more than ever. Anecdotally, several families with elementary school children are reporting increasing symptoms of screen addiction. How can we facilitate desperately needed opportunities to socialize while decreasing the deleterious effects of screen addiction? And maybe this is really a question for all of us, she says.
Yeah, briefly, I'll just say that, one of the things that we'll need is an alternative to video screens. There's definitely a place for them, but I think everybody on this call knows what Zoom fatigue looks like or feels like. And for our children to kind of like have that be the main way they communicate with other people, that may not be totally ideal. So what are the alternatives then? Well, there is one that people of a certain age, and I will include myself as one of those people, remember, and that was when you used to, go like this and you would talk for hours and there wasn't someone there. And that might be something worth bringing back in some ways, just as a way to kind of balance out the video time. Because I definitely agree, all the value of in-person interaction is it's being sort of hyper amplified by the video aspect of it, and that may not be a good thing over the long term. So one thing might be just to sort of shunt some of the social activities, perhaps for children, with that phone again.
Great, thank you, Ted.
And I might add and augment what Ted said. I agree with the mixture of ways to interact with other individuals, and also engaging children in activities that don't require the screen in their own, sort of exploration could also be something you could bring back in the lives of children that might not have been there as much as even pre-COVID. And I feel that at this stage, we're all sheltering in our homes. Eventually, the sheltering from in the home will be lifted, and people can go out into Mother Nature and explore other parts. Now the parks are opening up and so forth. So we can start actually maybe even having an increased experience and what we refer to as biophilia, right? The love of nature and everything living. So there might be some exploration that might come out of it that you could work with your children. I think the screen time, the hardest part will be if you continue to have distance learning for the children. I think that's going to be the hard part. But I've heard some very good creative teachers not having everything on the screen, giving them the morning work, an older group, giving them a sense of what they're going to do for the morning in the morning by screen.